Robinberg here. I'm a registered traditional Chinese medicine practitioner at Yellow Gazebo Natural Healthcare in Toronto. I also used to be a personal trainer, and I've always had a great love for exercise because I've seen the benefits that exercise can have for helping with pain and various other conditions and concerns. So today I want to present some hip exercises that you can do to help, to help relieve pain or even to help prevent pain that you might not want to have in your hip area. Keep in mind too, your hips are part of your core, so in strengthening your core muscles to help yourself with, say, back pain, even abdominal concerns, you always want to be looking at strengthening and maintaining your hips. So let's get started. We'll do some exercises that will encompass everything about the hips, and there'll be a link in the info section that'll give you a written description of these exercises as well, okay? All right, let's go. Okay, this first exercise is called bridging. It's meant to help your gluteal muscles, which are also known as your butt muscles. And this exercise is great if you're suffering from low back pain. It's good to strengthen your gluteal muscles. There are other exercises. See our video on low back pain prevention to strengthen your glutes, but this is a good way to start. It's also good for pain, believe it or not, in the front part of your thigh muscles, okay? So you want to get something like a rolled up towel or a foam roller. I've got a yoga block here. This is just as good. What you want to do is you lie on your back, your legs 90 degrees. You put the item in between your knees, and you want to just put your hands at your sides about 45 degrees, and you're just going to flex your gluteal muscles, hold for 2 to 3 seconds. Make sure you're maintaining a nice, strong contraction with the gluteal muscles. You don't want to engage your low back muscles, really. You really want to use your gluteal muscles. Hold 2 to 3 seconds, and then slowly lower down. You want to repeat that 8 to 10 times, 2 to 3 sets, and that's it. That's the whole exercise. Just make sure you really engage your gluteal muscles, okay? Next exercise. This next exercise is called Quadricep Setting. Quadriceps are your muscles on the front part of your legs. And with this exercise, let me tell you what it's good for first. It's good for, well, it's often prescribed for people who have just had hip surgery. But it is good really for anyone just getting started with exercise. Going to the gym, jumping on a bunch of machines, you're probably going to get injured. You need to do some prevention type exercises first, and doing this as a prevention for hip pain and injury is an excellent plan. So quadricep setting. One leg straight, one leg bent. The leg that's straight, very simply, press the knee into the floor. 2, 3, and hold. 2, 3, and hold. So I'm pushing down with my right leg here, pushing the knee into the floor, and what it's doing is it's flexing my quadriceps muscle, especially the part towards the knee, really strengthening that. And this is going to help potentially prevent knee pain as well, because you're strengthening this muscle, which helps lock the knee into place. Let's move on. Okay, this next exercise is also good for your quadriceps muscles, but it'll be really good more for the part of the quadriceps near the hips. So again, same position, one leg bent, one leg straight. The straight leg is the one, keep your arms at your sides, it helps protect your lower back. You're going to raise that leg, the straight leg, about 12 inches, 3 to 5 seconds, and slowly lower, and you're really strengthening this muscle in here. Try to avoid quadriceps exercises when you have pain in that part of your hip. If you have pain at the insertion of your quadriceps muscles in your hips, don't do these kinds of exercises because that'll just aggravate it. What you're doing when you're strengthening a muscle is you're causing it to shorten, causing it to tighten, strengthening it. So when you have pain in a muscle, generally that muscle needs to be lengthened, not shortened. So you want to do exercises that will, well, you really want to do stretching on the injured side and contraction on the uninjured side, and that usually helps most with healing. Okay? Next. Okay, this next exercise is excellent for toning the leg muscles, but is also good for just general hip stability. It's the side lying leg raise. Lie on your side,
And you're just going to raise the upper leg, hold for 12 seconds, and lower. It's good to have a hand in front of you. Keep the bottom arm nice and straight. Keep your body nice and straight. And you're just going to raise the top leg 12 seconds and lower. There shouldn't be any pain. And lower. If you do feel some pain there, you're probably raising the leg too high. Try, just only then raising it about maybe 6 inches. And make sure you hold. With any of these exercises, as with any kind of strengthening exercise, you should feel some kind of achiness towards the end and should feel, maybe the muscle burning a bit, essentially so that you're working it. And this exercise is for the abductor muscles, which are going to, adductor brings your legs in, abductor. Anyway, the inside muscles of your legs. These muscles are important to strengthen when you're strengthening the hip because they are part of the hip, okay? So don't just do a few of them and skip this one. If you're going to do the other ones, do this one too, okay? So you're going to lie on your side. You can prop yourself up if you want. I prefer to lay flat. You're going to put one leg behind the other, and it's the leg behind you that you're going to lift. You'll get more leverage, and your hip will be more stabilized if you're going to lift that back leg. So I'm lifting, my left leg is forward, my right leg, which is behind, is going to lift, keeping my toes pointing forward, lifting about 6 to 8 inches, 2, 3, 4, and slowly lower, up again, 2, 3, 4, and slowly lower. Remember, it's important to train all the muscles in your hip because, well, if you think your hip muscles as the front, sides, and back, you can't ignore just part of it, or you could open yourself up to injury even though you are essentially trying to prevent injury. So do the whole package unless prescribed otherwise. Thanks for watching. If you have any questions or comments, please feel free to email us at info@yellowgazeboclinic.com or give us a call at 416-909-2334. And you can book an appointment with me, Richard Laubenberg, anytime, or you can visit any of our other practitioners. We have massage therapists, chiropractors, physiotherapists, nutritionists, psychotherapists, everything you need in terms of natural health care. Thanks and have a great day.